In 2007, I was diagnosed with breast cancer. In 2009, the doctor came in and told me that the scans show I had stage 4 cancer in the bones and the liver. I don't know what I said. Stage 4 was what I heard. I thought, oh my God. I just thought, do I fight this or do I give in to it? And it took me about a day or two to get my act together to correct my attitude.
I actually discovered my lump myself. I was in the shower and I wasn't looking for it. It was just there. And I gave it a couple days just because I thought if it were something strange, like a pulled muscle or something that would resolve itself, but it didn't. And so I called my physician. A week later I found out it was something, and again at that moment our lives just changed completely. They called me and told me that it was breast cancer. We opted for a double mastectomy because the risk of getting breast cancer again was so high.
I'm Katie Messer. I'm a breast cancer and non-Hodgkin's lymphoma survivor.
I'm Kim Messer, and I am being treated for stage 4 breast cancer.
It's much harder watching Kim go through it than it was for me going through it myself.
I'm currently receiving chemo. It's very likely that I'll have a bilateral mastectomy.
A lot of unknowns, like how would it work out after it was done? What would it really look like? The shock value. And so it took a lot of getting used to, and I ended up really working with my surgeons to try to find a way to do the mastectomy that I would be comfortable with as far as the reconstruction. And so they did do a more conservative mastectomy where they were able to basically hide most of the scars.
Difficult choice to make, you know. You don't want to lose a breast. Women are vain when it comes to their breast, whether they want to say so or not, but you want your breast. I'm Sheila Craigwell, and I'm a breast cancer survivor.
I'm Liz Green, and I'm a breast cancer survivor.
It brings you closer together when you've both gone through something like this. You know, it's a bond that you really don't want to have, but we have it.
Yeah.
It was traumatic. You don't want to look down. You're bandaged up quite heavily, and they tell you don't be alone when you look at it the first time. You know, and what to expect. You know, you're used to seeing this 2 lumps, and you look down, you don't see anything. It's completely flat. And I cried. I cried a lot.
I wanted to take the pain, and I just felt so bad. I couldn't do enough for her.
I'm Jennifer Kegel. I'm a radiologist with the Lancaster Radiology Associates here at Lancaster General Health. Basically, I do all of diagnostic radiology, but I do predominantly breast imaging at this point. I also have gained a different perspective on it, having gone through breast cancer myself. I now know firsthand what my patients are going to go through. That often is helpful in sharing the news and then sharing when appropriate with some patients that I've been through it and they'll get through it.
How now do I live? And each person has to find that for themselves.
It's a whole range of emotions, you know, from disbelief to shock, fear, anger.
We're able to say to the patient, you're not doing this on your own. We're here for you.
We both attack and move forward and find solutions and face it head on.
She may have inherited breast cancer from me, but I think she also inherited that.
I likened it to going through puberty all over again because I came out of chemo, came out of surgery, and I started kind of becoming me again. Cancer can sometimes become consuming. It becomes a consuming topic. And so I think once I was able to not have that at the forefront of my mind and not to have everyone else worried.
It took me a while to look at myself because I felt like a part of me was gone.
We both cried.
Yeah, we cried.
We both cried, yeah. Oh yeah, definitely.
You have to cry a little
You gotta
bit.
cry, you get it out. Because you know, it's just like losing an arm or an eye not being there or something. It's part of you.
Most important things that I try to tell every patient is one step at a time. One moment at a time, because that's all we got. We're in this together.
We're in this together.
We're in this together, all of us.